One of the big questions that we oftentimes ask about our therapies regards efficacy, but remember, we can't forget itch is another important part of this discussion too. And in particular, how well, how fast, how deep. I mean, these are the kinds of questions that patients all want to know when we're really speaking about some of these drugs. And so the genesis of this particular lecture, given that it was falling into our section talking all about itch and RAD, was really just to give people a snapshot view of exactly why do all of these drugs work fairly effectively on itch, and are we able to parse through some similarities and differences when it comes to thinking about our medication options. We have a handful of targeted therapies that are approved for atopic dermatitis now in the topical and systemic realm. I tried to do justice and touch a little bit on each of them, knowing that some of our newer therapies are going to be the ones that were of interest to the audience. So in the topical realm, we talked a little bit about crisaborole and topical ruxolitinib. In the oral and injectable route, we talked about abrocitinib, upadacitinib, tralokinumab, and dupilumab as well, with just a touch on lebrikizumab too. It's impossible to compare any of these treatments head to head. That type of data largely doesn't exist. And so most of our ranking analyses come from systematic reviews and network meta-analyses that allow us to somewhat indirectly compare. What I tried to do first is just go through some of the original phase 2, phase 3 data from most drug drugs so people understand a little bit about how well they work on conventional measures of itch and what are some unique aspects. So in the case of topical ruxolitinib, which largely occupied most of my topical discussion, I really delved into the data that suggested that not only is itch relief quite deep for a topical, but very rapid. And in some of the more recent phase 3, phase 4 data, phase 2 data as well, suggesting that it's on the order of minutes to hours as opposed to oftentimes weeks that we think about with some of our therapies. I then had a chance to talk a little bit about our oral therapeutic options, which are JAK inhibitors, and highlight the fact that they're able to very quickly resolve itch and very deeply, perhaps in a way that we are not able to do with biologic therapies. And in fact, with our network meta-analysis, the high end dosing of abrocitinib and upadacitinib tended to be amongst our strongest therapies when it comes for itch improvement. I then finally touched on data from dupilumab and tralokinumab to show that despite us thinking maybe that biologics are not a speedy option for itch, most of these drugs do start to show separation between placebo and treatment pretty early on. And a number of individuals the longer on therapy really achieve very meaningful goals when it comes to itch. Bottom line, it's not a bad time to have atopic dermatitis in that most of our drugs are probably going to do a pretty good job for our patients. Unmet needs are still a thing when it comes to itch. And we know that with most of our drugs, they can do a pretty good job, but there's definitely going to be individuals that don't have an adequate response or other individuals that don't have a complete response, meaning that individuals might get to a very low and tolerable level of itch, but they may not be totally itch free in that they have a 0 out of 10 if we ask them how itchy they are. And we should always aim high with our goal. And I think the real big challenge we have is figuring out how we cross that hump of getting individuals who are severe, but relatively mild, and then getting the ones that are relatively mild just totally clear when it comes to thinking about it. I think from a patient perspective, remember, symptoms are oftentimes as, if not even norm 4, a good sign. So you just have to do a good job and ask about a few, itch probably being the top of that list. And from a healthcare provider side, you really should be thinking about efficacy, not only in terms of somebody getting clear or almost clear, or 75% improvement, they're easy, but also in terms of symptoms as well, of which it should be at the top of that list too. Patients and healthcare providers really want the same thing. It's important that we're all beating each other at what our shared goals are.